on the elderly man who fell sick and very little help came to him or for him. And then we'll also talk about some child rights. To help us with this conversation is Deputy Minister for Gender, Children and Social Protection, John Alexander Akon. And the focus of the conversation is to answer the question, what social protection interventions exist for the homeless and destitute? Thank you very much for joining us here.
Yeah, thank you.
Before you answer that question, really, you know the story. What are your thoughts?
Oh, generally, there are two sides of it. And it is important for Ghanaians to know what systems and policies are there for the destitute. Normally, you don't look at somebody in the street and say it's a destitute. There are those who are classified as such. So social welfare will take care of that particular person. Indeed, if the news has gotten first to the social welfare officer, he would have laid the police and, for that matter, the ambulance service, and that somebody would have taken the responsibility, which wouldn't have bothered the hospitals. Because normally they think somebody will dump the person there, leave for the hospital, and it goes. The other thing I can say is that because of the state of the person, the hospital for a start could have done the welfare and voluntary service and get a linkage to social welfare. If you go to places as Swedru and maybe Bekwai, we have home for the destitute. What we do at the ministry is that for all the homes of destitutes, beyond their budget, we try to put all of them in the institution under the LEAP project. So they get cash handouts to the institution to help them beyond the normal budgetary allocation. So they're able to take care of themselves. But if it doesn't come to attention, that's what actually happens.
Shouldn't we have a database of these people who would classify as destitute and homeless who actually qualify for social protection interventions like the one you have mentioned? Yes,
honestly, if you say destitute, you're talking about database. It's always from hindsight, because you don't expect somebody to be a destitute. But what we do, that intervention is very well classified, and it borders on the responsibility of the family too. What it does that, it says that the category of people who qualify and their households are in the category of those who are 65 years, very extremely poor, and they benefit from that facility. There are others,
that is the LEAP.
Yes.
You have to be 65 years and above and extremely poor.
Yeah, that's the baseline. There are three categories. The other one is that it should be what is called the OVC, orphan but vulnerable children. We give you a caregiver, we put you under the health insurance scheme, we give you the cash transfer, which I'll be doing again this time around, and then somebody takes care of you through your schooling, and it goes. The last batch is people who call disability without employment capacity. Some disabilities are said that he or she can just not work. On that alone, we also put you on the same scheme, and then you enjoy till you go out of the system. So there's a protection in the system. And if you have to
I'm happy you have classified the categories of protection levels, for lack of a better description.
Yes.
The reason I asked of the database is, one, we hold census. We know the kind of people we have. And for me, if the state institutions work together, it should be easy for the ministry to get a database. And then secondly, why is it that unemployed people are not covered under any social protection scheme?
Unfortunately, you call people unemployed, but who classifies unemployment?
The ministry could classify what unemployed could be.
You do census, so the statistical service will give you that census, and we have all of them here. What it means is that even for the extreme poverty, statistical service will give you, and recently they have even done what is called the Ghana Living Standard Survey 6, which classifies those who are extremely poor, and then we intervene. So the fact that you are on the street does not necessarily mean that you are under that regime, and something else will need to be done to you. So if you are not registered in the family, if someone is destitute and the family doesn't get a person registered, you are not going to be captured. So it's important to really get it from the family responsibility, so that it will be easier to capture them from that base.
Okay, so if person A is unemployed and destitute, the person is supposed to be registered and
from the household.
From the household.
Household, where it belongs to, as the household.
Okay, how do I get myself registered in the first place?
You don't get yourself registered. The point is that we come around.
You come around?
Yes, okay. We do a lot of research. We do what is called proxy means testing. Okay. It's a software. And then even when your community is described as a poor community, it doesn't mean every household there is a poor house. So they'll come and gather all that information and subject it to that standard. And then it will come out to those who really need an intervention. So any such person should have a house. And therefore it should be rested from among the household. And they will capture you.
I'm happy you say you're proactive. In which areas do you usually go?
We don't have areas defined. We only take the information. And as I'm talking now, you know, it's a scheme, the LEAP particularly, it started from the year 2008. At that point, we had only 21 districts. And in terms of household, we had about 1,642. As I speak to you today, we have 103 districts. We are operating in all 10 regions. And we are dealing with 76,913. We are about getting to 100,000 very soon. And by the end of 2015, we'll get to 200,000 of those who should qualify under the scheme. So we take the baseline information from Ghana Statistical Service, from what is called the Ghana Living Standards Survey. And that gives the leap as to where to go. So it will be defined. Something that is coming out from the ministry, it is called the National Household Registry.
Very well. I'd want us to go into the other things the ministry intends to do. But it beats my mind that even after all that you do, let me take the capital city where I'm comfortable with. We still have people on the streets.
The streets
how is the ministry able to wrap its mind around that?
You know, the streets are not the determination of extremely poor. Indeed, there are even lazy people about in town. You don't say by that means they actually belong to the extremely poor category. So statistical service will need to determine those who belong to that category.
Why would anybody want to be on the streets?
Unfortunately,
and you are not poor, but you want to be on the streets.
Unfortunately, you don't even know that in the developed country they have homeless people. But we go there, we're able to get a home and work and get money. So people have their own classes of thinking and easier ways of getting money. Some don't want to work. Some have been trained. They just feel it's comfortable to be there because at the end of the day, without working, maybe it's more attractive in terms of money to do. So if you go to the Ghana Federation of Disabled, they are against that particular situation. But others also do it.
But when you pick our situation, it's not like there are any unemployment benefits to being on the streets or homeless benefits to being on the streets. So again, I will say, it beats my mind why an elderly man would prefer to be on the streets.
That is a good research you should do. And the question is to ask yourself, at the end of the day, starting from morning, if he's on the street, up to the end, and he's soliciting for funds, how much did the person get? Does it make him satisfied and that's all content? And we don't want to work or what? We need to do a research on that. But that's not the target. The target is to ensure an appreciable level of dignity for all persons. And we think that people should be registered in their household.
Why hasn't the ministry found it interesting to be able to do that research? Because when you want to blanket all of these people as being lazy, perhaps, you might lose sight of the people who really, genuinely need your help.
Yes, not the lazy contest I'm talking about, but I'm saying that when you go to the house, every person on the street belongs to a house. So if that person is registered in the house and captured as such, we'll take off that particular person. But if you're not captured, you don't belong to the extreme poor category, and your household themselves don't get you registered, we shall not know.
In the case of this man, he more or less has no family because the family has rejected him. And so when you have cases like that, how do you capture them? Because then you don't belong to a household. You don't even have family to constitute a house, then a household.
You know, interestingly, in the Ghanaian context, and we work on that very strongly from social welfare perspective, we think that there's an insurance system in our extended family system. And we've done some very recently. What we realized at the ministry was that people were opening orphanages all over the place. And they were numbering, because they're funding from somewhere that goes to that area. So we had to do an immediate exercise and close down most of them. And we were able to assimilate more than 1,000 children back to their families. So at times you go beyond to do a little bit of an effort. And the families receive them with open hands. And they are with their families now. Those who are on blip are there. Some of them are capable of taking care of them. So the point is that when we go beyond there, we see those who actually need the support and we help them. So I'm saying that we should, in trying to do that, make sure that the family play their role. Just get the person registered. After all, when they're doing census, you need those people to be registered. And they should belong to a house, pass out of her mat. You remember, when census is coming, they ask very interesting questions. How many of you have been to school? Did your parents go to school? Do you have what's your house? How many of you are in the house? Is it made of bricks or what? All those are determinants of poverty. You know, some few years back in Ghana, possession of a mobile phone was a mark of poverty because not everybody had it. Today, would you add it onto the test? No, because everybody has a mobile phone, so it's not determinant. So we change it according to time. So when your house becomes conscious or you get registered, we get you. But not anybody in the street is supposed to be in the street, on the street. They are not some of them supposed to.
I'm happy you mentioned the fact that sometimes you've had to take some of these people to the family. But you see, I think my concern is being with how the registration is based on households. Because then, if there is a rift in that same extended family that's supposed to help you, and you can't go to that extended family or to any household of any kind, then it means that you never be captured for any social protection
you are
intervention.
Introducing something we don't want to encourage. What it means is that there may be a rift, and every rift is solvable. You can solve them. So what social welfare does, and that's a system that is happening in our policy, is the fact that it will intervene and ensure there's harmony in the house for you to be received. So if indeed there's a rift, it doesn't want to be received.
But isn't it better to have the full coverage of those people and be able to sieve out the bad nuts from the good ones?
Unfortunately, the house is the best place to get the family members.
For instance, you opened your office for registration. Well, you think you're poor or you're homeless, come register. And then you take your time to sieve it out.
The approach will not be workable if you know the psyche of the Ghanaian. You say, we are going to register the poor.
You are assuming the psyche of the Ghanaian.
Yes, come and stand outside there and say, I'm registering the poor. Can you imagine what's going to happen to you?
You are assuming the psyche of the Ghanaian. But what I'm saying is that you still have a control as the ministry to determine who on the registration list is poor, homeless, unemployed, or not.
So we are using the household register.
I'm saying that a household registration leaves a lot to be desired.
I don't think so.
Because
rather, they are the exceptions we need to address. Because most family members are able to handle their families. There are few exceptions who will be outside, which we should handle differently. And that's why you should introduce me to, so that we know how to approach that other side. But indeed, if I'm your brother, my child is your child. That element is working very greatly in our system.
But you agree with me that society is gradually breaking down.
We're
having more individualistic nuclear families than the extended
Unfortunately,
ones.
no, we are not having more. It is being addressed, but we think we should not entertain it. That's why the next policy we are coming for, even the child, is called the Child and Family Welfare Policy. We don't want to break away from our traditional systems.
In the case of Jacob Basil Asare, the elderly man, we here at Joy News decided to offer some help when our attention was drawn to his story. He's currently at the Ridge Hospital receiving treatment. In fact, he's responding to treatment. Are we going to see you there?
You don't need to see a minister. It's a very simple process. The moment Joy goes through it, even now, just talk to the social welfare person in charge. He will take care of that.
That's what I meant. I didn't mean you.
Yes.
In person.
Go to the district.
But your outfit.
That's our outfit. Go to the district, talk to the social welfare person. If he has to live in a destitute home, he will take care of that development. You
were also telling us some of the things that we should expect the ministry to come out with briefly to help with social protection here.
Yes. Apart from the policies I say we are coming out with in terms of what is called a Child and Family Welfare Policy. There's also a child justice system that will also come next year in terms of how to handle a child who gets himself into a criminal situation. You don't give them the same treatment. That's what we're going to do. But to address all those questions, on the 18th of this month, we are doing what is called the first National Social Protection Conference. In fact, we've invited somebody called Marcia Helena Lopez from Brazil. And Brazil and South America has one of the best social protection systems throughout up to graduation. And then she will be coming here as a special guest on the 18th. She also give a lecture at Legon Center for African Center for Wetlands, and that will be on the 21st. The protection is on conference center conference, and then it will be on the 18th.
I see.
So there will be interesting things. The day you're going to see those who have been supported by the various pro interventions and what has become the result, and eventually we open the conference.
I also recall that the ministry was putting up a database of children across. Could you just throw a bit?
Yes, I just told you about what we are calling the National Targeting Center. We do have a database. If I should read this manual to you, of any category of children, of those disabled, of women in public service, in parliament, in executive, in chief executives, all that one, we have a lot of information on them. so that if you're addressing, you know what to actually target. I mean, for example, if you say...
Let's expand it to persons in the middle brackets, the working class who perhaps don't have any jobs.
Yes, if I have time, I will get you there.
Unfortunately, we don't. Maybe we'll do that off air. Thank you very much, John.
Thank you.
John Alexander Akon is Deputy Minister for Children, Gender, Children and Social Protection. I'll be right back. Don't go away.